If you have PCOS and you have unwanted excess hair growth on your chin, on your upper lip, chest, tummy, then you know the struggle to keep that hair growth under control. What's worse is that you may be having unwanted hair growth in certain places, but hair loss on your head. And if you are going through this, then I'd like to share with you some things that you can try to keep that excess hair growth under control. These are all natural approaches to managing hair growth, and they can be done in conjunction with any treatment that you may be currently on. And so the first thing is to get your insulin resistance under control. One of the driving factors that causes excess androgens, which is male type hormones, which is the foundation of what PCOS is all about, is insulin resistance. Now, when you are insulin resistant, your body doesn't actually respond to insulin as it normally should. And insulin is a growth hormone. It also triggers the excess production of male type hormones, also known as androgens. And androgens are really what are responsible for excess hair growth as well as hair loss on the head, what's known as androgenic alopecia. And so one of the important things to keep in mind is to get to the root cause of why you are having excess hair growth in the first place. And that may be as a direct result of insulin resistance. So you can get your insulin levels tested by your doctor. You may have been already told that you have insulin resistance. But if you even haven't had your insulin resistance or your insulin level tested, then you may be experiencing certain symptoms that could give you clues. Things like weight gain in the tummy area, intense craving for carbohydrates and sweets, difficulty losing weight, feeling hungry all the time, having skin tags, darkening of the skin on the neck and under the arms and in the groin. This is known as Acanthosis nigricans. These are just some of the symptoms of insulin resistance. And so if you are experiencing any of these symptoms and you haven't had your insulin levels tested yet, I would strongly encourage you to get your doctor to have your insulin tested. So if you have insulin resistance, it's important to start by focusing on that as a root cause of your excess hair growth. Some things that you can try to reduce and reverse insulin resistance are combining carbohydrates with protein, fat, healthy fat, and fiber. So in other words, don't eat carbs on their own. Don't eat naked carbs. And so combining carbohydrates with either fat, fiber, or protein, or all three, will help your body to manage that insulin spike and that blood sugar spike that comes after you've had a lot of refined carbohydrates. Another tip is to drink vinegar before you have your meals. Vinegar has been shown to help to manage the blood sugar spike that may come after you've had a very carbohydrate-loaded meal. It just helps to stabilize your blood sugar levels and keep those levels from excessively spiking, which actually triggers an insulin spike. And so you can have a tablespoon of apple cider vinegar in a tall glass of water before your meals, and this will really help to manage your sugar spikes and therefore help to manage insulin spikes as well, which trigger insulin resistance. Increasing the amount of fiber that you have in your diet will also help to prevent those blood sugar spikes that are associated with insulin spikes and that lead to insulin resistance. So try to focus on increasing the amount of fiber that you have in your diet. One way that you can do this is by switching out refined carbohydrates for whole grain alternatives. You can also focus on increasing the amount of vegetables that you have in your diet. And you could even consider adding something like chia seeds into your diet as well. So 2 tablespoons of chia seeds in a glass of water, perhaps even with your apple cider vinegar in that, before you eat your meals will help to keep you feeling fuller for longer, and it will also increase the amount of fiber that you're taking in on a daily basis. Another strategy to reverse insulin resistance is to do resistance exercises. So over-exercising is not advisable with PCOS, but if you are doing resistance exercise, then strengthening your muscles will help to better control your insulin levels. So trying to incorporate some kind of weight training or resistance training into your exercise routine is really going to help you to manage your blood sugar levels. Inositol is a great supplement to try if you have PCOS and if you have insulin resistance. It helps with a host of things, reducing cravings, reducing insulin resistance, helps to improve ovulation, and it can also help to reduce the amount of excess hair growth that you're experiencing because it reduces insulin resistance. So getting on a good inositol supplement is also something that you can try if you want to reduce excess hair growth and manage your PCOS symptoms. It's just important to make sure that you get a supplement that contains myo-inositol and dechiro-inositol in a 40:1 ratio. And to ensure that you're taking 2 to 4 grams a day. If you are in South Africa and you're looking for a great inositol supplement, then you can check out the one from Meluno. If you use my discount code #Dr. Carmen James 10%, you'll get 10% off your order. This particular blend of inositol is in the appropriate 40:1 ratio, and it also contains other vitamins and minerals to help you manage your PCOS symptoms naturally. Meluno is also dairy-free, gluten-free, sugar-free, and free of unnecessary fillers. Check them out in the description. If you want to learn more about insulin resistance, I will link to another video in the cards and in the description box below. The second thing that you can try is to eat anti-inflammatory foods. One of the other things that may be underlying, or the other root causes that may be underlying excess hair growth or excess high androgens, is inflammation. And so eating an anti-inflammatory diet may help in the long run to manage your excess hair growth. So just think about eating the rainbow, so a wide variety of colorful vegetables, as well as incorporating certain spices into your diet like turmeric and ginger, which have powerful anti-inflammatory properties, will help you to reduce your inflammation. And to tag on to that point, try to limit the amount of inflammatory foods that you're eating. Inflammatory foods are foods that are highly processed, that often contain excess salt, oil, and sugar. And they're generally foods that are not whole foods. And they often tend to spike your blood sugar. So eat more from the earth and less from a box. I think that's the best way to think about it. So eat whole foods and foods that are going to be nutrient dense and not have a lot of their nutrients stripped out of them. If you have PCOS and you're confused about where to start and what to do to start managing your symptoms naturally, then check out the PCOS Made Simple ebook and workbook combo. It will walk you through some of the basics of PCOS so that you can better understand the condition, and then it will guide you to finding your PCOS type, and then it will guide you on specific things that you can do immediately to help manage your PCOS symptoms naturally based on your PCOS type. There's also a list of blood tests that you can request from your doctor, a list of supplements that you can take, as well as PCOS-friendly recipes that you can try. They're all super delicious, naturally gluten-free and dairy-free, and there's something in there for everyone. You'll be able to find recipes whether you eat meat or whether you're vegan or vegetarian. These recipes were specifically designed for you if you want to start eating in a way that helps to manage your PCOS symptoms, but you're confused about where to start and what to eat. So go ahead and check that out in the description below. And if you're looking for extra guidance and help, I do have a PCOS 6-week coaching program that walks you through the basics of PCOS. So each week there's a different aspect of PCOS that you will be learning about. And you will have a session with me, an hour-long session each and every week as you're going through the program, so that I can help to guide you and give you some feedback with regards to your specific needs. So I'll leave a link for that in the description as well. Another way to reduce excess hair growth is to reduce or limit or even stop caffeine. If your body is really stressed out, and if you are experiencing a chronic medical condition, and especially if one of your root causes that is driving your condition is stress, then having lots of caffeine in your diet can actually make that worse. Caffeine generally tends to give your body a nice burst of energy, but it can be really stressful to your body if your body is already undergoing extreme stress. And so for those of you who love coffee as much as I do, it may be time to limit or cut back on, or even cut out altogether your caffeine intake, at least to give your body a chance to reset and reduce the amount of stress that it's under, because this may be contributing to your overall level of stress, which may be feeding into excess hair growth. Both licorice tea and spearmint tea have been shown to be helpful in reducing your body's androgen levels. It's just important to remember that if you have high blood pressure, that you shouldn't be drinking licorice tea. But both of these teas can be helpful in reducing androgen excess, and because of that, they can help to better control excess hair growth. Ensuring that you get good quality sleep is also important for inflammation and helping to make sure that your body is not overly stressed out. So prioritize your sleep. Get into a routine that has you sleeping at the same time and waking up at the same time every day, regardless of whether it's on weekends or not. Make sure that you are avoiding screens about an hour or so before bed. Try to reduce the amount of harsh lighting that may be in your environment just before bed. Have a nice hot Epsom salt bath before you go to sleep. Do whatever you need to do to help you wind down and prepare for bed. And make sure that you are getting in at least 7 to 9 hours of sleep every night. Another addition that you may want to try is cinnamon. Cinnamon is anti-inflammatory, and it also helps to reduce the stress response. And as a result, it can be helpful to reduce excess hair growth. Cinnamon also helps to manage insulin resistance, and as a result, it can help to reduce androgen excess in this way. So including cinnamon into your diet is another thing that you can try to help to manage excess hair growth. Another way to help reduce excess hair growth if you have PCOS is adding in adaptogenic herbs. Adaptogens are basically herbs that help our bodies adapt to stress. Some examples of these would be rhodiola and ashwagandha. These help to reduce the fight or flight response and reduce the inflammation associated with stress. This can help us get to the root cause of what's causing the excess hair growth and the androgen excess in the first place. And so as a result, it can be really helpful for controlling these symptoms. Another example of adaptogens would include CBD. And so including adaptogenic herbs into your regimen is something to consider, especially if you are struggling to control excess hair growth if you have PCOS. Another supplement that can help to manage excess hair growth in PCOS is zinc. This is particularly important if you are struggling with symptoms of high androgens like excess hair growth as well as acne. Zinc is a fantastic supplement that helps to reduce androgen excess. And if you have ever been on birth control for whatever reason, or even if you've been put on birth control to manage your PCOS symptoms, then getting on a zinc supplement is going to be vitally important because the birth control pill does tend to deplete zinc. Thank you so much for watching. Leave your comments, questions, and suggestions for future episodes in the comments below. Don't forget to subscribe and watch the next video on your screen because that's the one YouTube thinks you should watch next.